Hello, fellow academics. Today's discussion is on the association of concussions with suicidal ideations and suicidal attempts. There are many types of traumatic brain injuries, denoted as TBIs. These CT scans show the 6 main classifications of TBIs: epidural hematomas, contusions and parenchymal hematomas, diffuse axonal injuries, subdural hematomas, subarachnoid hemorrhage, and intraventricular hemorrhage, and finally, diffuse brain swelling. Concussions can be defined as mild TBIs, and they are the most common form. Since many systematic reviews have associated different TBIs with a higher risk of suicide, the question arises, are concussions, which have less severe consequences, also associated? Okay, so let's assess this research paper further and discuss its implications. The methodology included finding and selecting eligible primary papers, of which 17 were found, with roughly 713,000 patients and 6 million controls. This was a trans-ethnic study that included North Americans, Scandinavians, and also Australians. 6 of the 17 studies reported suicide as the outcome. The studies all used death certificates in identifying suicide. Interestingly, the risk was twofold in patients with concussions or mild TBIs compared to patients without. This means patients with a concussion are twice as likely to suffer from suicidal ideation and attempted suicide. The possible causal mechanisms for suicidal ideation may be related to the structural changes in the brain regions crucial for cognitive and emotional processing. These changes have been associated with clinical depression and neurophysiological deficits, especially in athletes. This study was a fascinating read, and it particularly stood out as it focused on concussions or mild TBs, and not severe ones, which was the case in other studies. What was more fascinating was that it also challenged the preconceived notion that military personnel had a higher chance of suicide ideation or attempted suicide due to concussions, because it showed that military personnel actually had a lower relative risk. Does that mean we need to address safety regulations in contact sports, as suggested by some? Or do you think the relative risk is worth it? That's it for today's Levitate journal commentary. Make sure you subscribe and leave a comment on what you think about this study. And as always, links to the studies will be in the description below.